So as soon as you arrive in hospital or find yourself in a difficult situation, start making notes. If you're the patient and you can make notes for yourself, absolutely amazing. If you are there as a family member or as a friend, please start making notes on behalf of the patient. And then keep those notes with the patient. So if it's a diary, it's kind of easy because it's a book. If you start out with pieces of paper, please get some sort of booklet or diary as soon as possible. So the idea is that this paperwork stays with the patient. And it's a private thing. It's got nothing to do with the hospital paperwork. It's a private thing so that the patient knows what's going on and the family and friends can come in and read that diary. So they know what's been happening and they can ask questions and have conversations with the patient about their healthcare trajectory and what's going on. So, how would you continue to use that? When you're visiting, make notes. Have a quick look in the diary. Who else has been here? What have they talked about? What seem to be the major concerns of this particular friend or family member? And then during your visit, write down the key points of conversations you've had. Maybe the doctor came to visit whilst you were there. Note down some of the key points of that as well. It's so often that a doctor visits a patient and then, if there's no one there, there's no one there. But if you then later ask, the doctor's just been here, everything okay, or what's going to happen? They find it very difficult to summarize what the doctor has said. So even for people who are fully aware, fully oriented, who could ask questions, a doctor's visit is so quick. It happens at a moment in time the patient is not prepared for. The visit is initiated by the doctor. It's not that the patients sit in a waiting room and are waiting to be let in to see a doctor. No, they are in a bed and the doctor comes around when the doctor has time to come around. Even though people know it's coming, it's always a bit of a surprise. They were doing something else and, oh, there's the doctor. And for some reason, it seems to make it difficult for people to ask the questions they want to ask, to remember what the doctor has said. If you, as a patient, can write down the keynotes, that's already a huge step. The doctors on our ward are absolutely lovely to talk to. And if you've got questions, they're willing to explain to you what's going on or to explain the background of whatever it is you want to know. But the question needs to be there. And if you are surprised by what's going on and surprised by the visit and have no clue, then those conversations are not happening. The doctors can only do so much. So if you're a patient, make notes yourself. If you're family or friends of a patient who can't really do that for him or herself, make the notes for them. For family members who want to be there when the doctor comes around, again, same. Make sure that you read up the notes that are in the diary. Make sure you've got your questions ready. Make sure that you actually ask the questions that you want to ask, with, of course, permission of the patient, because you can't just barge in. It has to be all done with permission of the patient.